Ladies and gentlemen, welcome to MedSynapse Specialist Podcast series. In today's episode, we have a very crucial topic to discuss: menopause. Joining us as our esteemed guest is Dr. Basema Jaber, a highly experienced consultant obstetrician and gynecologist at Emirates Specialty Hospital in Dubai Healthcare City. Dr. Jaber is passionate about women's health and brings a wealth of expertise in guiding patients through the complexities of menopause. Today's discussion will be structured around three main areas, including effective symptom management, health and life considerations, and critical aspects such as cardiovascular health, memory changes, and so on. Welcome, Dr. Basema. And thank you so much for joining us today on this important topic. Let's begin the podcast. To begin with, we know that managing hot flashes and night sweats, which are very crucial during the menopause, requires effective strategies. How can these symptoms be effectively managed?
Yes, actually 80% of women suffering from hot flash, and it's because after menopause or even pre-menopause, we have decrease in estrogen, which is responsible about regulation center of temperature in the brain. So usually we have this issue. We have sensation of high temperature in the upper body. It happens especially in the morning as cortisol, which is a stress hormone, is increased in the early morning, and dehydration, or the night there is no water, and also stress. As I told before, it is related to decrease of estrogen. That's why we need to do something against this risk factor. Like dehydration, it's better to drink more water, especially before sleeping. And also, we have to deal with the stress. Life is full of stress, and we have to deal with stress by breathing, exercise, by meditation, by yoga. It's important. Even pray and religion is very helpful in that situation. And we need to increase phytoestrogen. I need some estrogen instead of estrogen which we lost. Like there is a lot of things we can get it as tofu, as flax seed, as a lot of things. It will be help to increase phytoestrogen in our body. Also, they advise us to get magnesium. They advise us to improve quality of sleep. There is a lot of things to improve quality of sleep, because decrease quality of sleep, because this change in hormone, it will be increase hot flash. Also, we also advise to decrease spicy food, to dress cotton things, to hold a small fan. If we are in hot temperature, it will be more difficult. So all these things will help female to decrease hot flash. By the way, it will be decreased by time, but some female suffering a lot more than 6 years, 8 years from this hot flash. It's different from female to other female.
Dealing with mood swings in menopausal patients is a challenge that requires patient-centered approach. What tips do you have for doctors in handling mood swings experienced by patients during menopause?
Same. Changing in the estrogen causes this problem. So we need to improve quality of sleep. We need to take magnesium. Bromoroids oil is very good. Doing breathing exercise, relax, and we need more rest, because it will be help. We need to deal with depression. It's no problem to go to psychiatric. Sometimes we need some medicine. According to FDA, they approve to use selective serotonin reuptake inhibitor, because estrogen is a happiness hormone. Why? Because serotonin is happiness hormone, and it is stimulation by estrogen. When we lose estrogen, we lose serotonin. So we need to increase serotonin in our body to fighting with this situation. Of course, we need to live in good weather, use phytoestrogen, exercise, and water. We have to against dehydration, because dehydration in this situation is very bad for the body. As I told, we have to depend on healthy lifestyle. I mean, healthy diet, and don't take caffeine, alcohol, smoking. All these things will make everything is more difficult. And in sometimes, if we have difficult issue, we can deal with hormone replacement therapy. This is according to your doctor. In individual decision, we can decide who's need HRT and who's not need HRT.
Moving on, could you provide advice for dealing with sleep issues during menopause?
Yes, sleep issue is very bad, because if there is no enough rest, that means we have more anxiety, more depression, and more hot flash, more sweat. So we have to deal with this issue. There is a lot of supplement, a lot of things we have to use it. Exercise, as I told you, breathing exercise, also the breathing exercise, yoga, meditation. We have to deal with this issue, and we have to sleep in a very dark room, not use our mobile or not see TV. Try to do our sport in the evening, get a glass of yogurt, doing douche with hot water. All these things will help us to improve our quality of sleep, because it is very important to increase our quality of sleep to avoid a lot of complications.
Moving on, what is the role of hormone therapy in providing relief from menopausal symptoms, and what factors should doctors consider when recommending it?
Yes, before in last century, they consider hormone therapy as improved quality of life. They tell us about benefit of this therapy, but actually there is a risk from using therapy to get breast cancer, to get heart disease. So we have to consider this therapy as individual for every female by herself. We advise to not use hormone therapy, but in some cases, like if we have osteoporosis, if we have a severe hot flashes, we couldn't stop it, severe disturb in sleep, depression too much. Sometimes we use it, but it must use under control, close monitoring, and individual decision. We couldn't say to all female to get it as in last century. In last century, I read a lot of books with encourage use HRT, but this day, no, it is not easy. Of course, there is a lot of symptoms because degrees of estrogen, but we have to adapt and use other way to control on this complication, on these symptoms. But in sometimes, yes, we use it for a short time. And some cases, unique cases.
Weight changes are common during menopause. What strategies do you suggest for doctors to help patients manage changes in weight that can occur during menopause?
Yes, actually, we face also decrease in the metabolic. Not only metabolic, we have to take care of thyroid gland. Usually after 50 years, thyroid gland is decreased function. And also in menopause, there is decrease in activity, no exercise. And what about diet? So we have to manage all these things, even disturbance during sleeping. Yani less sleeping, that mean more cortisol, more stress. So we have to deal with stress, with disturbance, sleeping. We have to deal with less activity, to do exercise. We have to deal with dehydration, more water. We have to go to meditation, to yoga. We have to do, as I told you, more important exercise is weighting exercise, because it's prevent resistance of insulin, and it will be make our bone is more strong, which is a very serious complication of menopause.
Now, vaginal discomfort is a common concern in menopausal patients, and it's important to explore available options for addressing it. What options are available for addressing vaginal discomfort in menopausal patients?
Of course, estrogen is very good hormone for moisture vaginal skin. So we face this issue after menopause. There is dryness in vaginal, there is dryness in the skin. So we have to face this problem. How we can face? We have dyspareunia, which is caused painful during intercourse, and usually 25 of female degrees in desire for sexual. Also, as I told you, if she not doing intercourse, that means it will be decrease in functional vaginal also. So usually we use lubricant, and we need natural things. It's not allowed at all to use any chemical things for lubricant, because it will be, this environment is very delicate. So also cosmetic gynecology is offer something amazing for female, which is plasma. Plasma will face this dryness, and it will be help woman to rejuvenation vaginal, dehydration, and also elastin, collagen, everything will be come back after injection of plasma in some place of vaginal. This is a very big issue, and this is cause what we told about it. It is atrophy, vaginal infection, and cause burning sensation, and after intercourse it happened also infection, bladder infection. So we need to deal with this issue. Caution to, sometimes we use even a small quantity of estrogen, local estrogen, but I feel that plasma is very good. Every 5 or 6 months we can deal by plasma to rejuvenation vaginal. And as I told, lubricant by natural things is like lavender, like coconut, something like that. We need anything natural, free from chemical.
We all know the importance of supporting bone health in menopausal patients. What guidance can you offer to doctors on how to support menopausal patients with their bone health?
Bone health. This is a major complication of menopause. Osteoporosis is happened after menopause because there is no increase in estrogen, which fixed calcium. Actually, it's silent disease and very serious disease, and it causes fracture even after cuff. We discover osteoporosis only after fracture happened, which is very bad complication and very bad to healing also. So usually, even from pre-menopause, we advise all females to do sport. Especially, we need weighting exercise, walking, jumping. All this exercise must be a part of our life. Also diet, which is increase in milk products, which is very important for female. I don't advise female to get calcium alone because there is some side effect. It's better to deal with natural things which give us calcium, like egg, yogurt, milk, cheese, all these things. It is important also by phytoestrogen as flaxseed and tofu, and we need to increase also even vegetable and green fruit also, vegetable, green vegetable. All these things we need to increase nutrition for menopause, because if decrease in nutrition, anyway there is a decrease in digestion symptoms, so we need to help also by friend bacteria for our digestion. All these things is important, and all these things important to make, we need more calcium, more magnesium, because magnesium is a bus whose calcium going with it. We need more vitamin D. Vitamin D, 90% of vitamin D from sunlight. And we need also vitamin K. All this nutrition is important. We need to get it from natural source, and we need sunlight, we need exercise, we need more and more taking care of this issue. Otherwise, we go to osteopenia, which is before osteoporosis, which is very difficult to deal with it.
Moving on to our next question, how should doctors handle symptoms related to cardiovascular changes that occur in menopause?
Yes. Actually, this is very common because estrogen increase good cholesterol and decrease bad cholesterol. What happened after menopause, it's against that. Bad cholesterol will increase and good cholesterol will be decreased. And if there is no activity, if there is like family history of cardiac problem, if there is any bad habit like smoking, alcohol, more caffeine, all these things is bad. We need healthy life. We need cardio exercise. We need to check from our heart if there is anything we can discover early. Nowadays, there is a lot of many surgical can improve us. And as I told you, use natural things. It will be help a lot. Increase quality of sleep, more rest. And if we need psychiatric, why we don't go? Sometimes we need a psychiatric consultation, and we need some medication, because even this depression, it will be, if we don't deal with help with good manner, it will be, give us a lot of bad complications.
Moving on to our next question, what are the effective therapies for addressing memory changes in menopausal patients?
For memory, in 5 years, all female women will suffering from memories problem, and it is very embarrassing them, like they forget name, they forget where she put her key, where she put her car. Also, it is related to estrogen. There is a lot of receptor of estrogen in the brain. For this issue, we need more rest, less stress. We need dehydration, deal with dehydration, more water. There is a lot of supplement will help, like ginkgo biloba. Also, they advise this female to go to a new hobby, like learning a new language. Try to doing something in her brain, try to do something. And this issue will be decreased by the time, but we need to early diagnosis if we have dementia or Alzheimer, because even this disease, it will be appear clearly after menopause. So no problem to consult some doctor to check where we are, what the degree. If it is less, we need to do exercise, more water, ginkgo biloba supplement. Some supplement will be help, and more rest. It's important. Dealing with stress with meditation, yoga, and deep breathing exercise. All these things will help, and we can try to put your key in certain place. If you go to mall, try to get photo for where you put your car. It's normal. It is common symptoms of menopause, not only for female, even male. With aging, it happened, but we can fix this by more training our brain. Like some people try to read Quran, try to reading more stories, try to speaking with friend. All these things will help, my dear.
Lastly, in your expertise, what advice can you give to doctors for initiating conversations about the sexual health and addressing intimacy concerns with their menopausal patients?
Of course, menopause does not mean female useless for intercourse. No. They facing some problem, but we can deal with this problem. As I told, we can deal with this problem, and a lot of female could join with sexual also. Even as I told before, 25 of female decrease in desire of sexual. This is related of relationship between partner, and this is related to understand what's going. Dryness, we have to face dryness. Rest, exercise, Kegel exercise, and use lubricant. Sometimes we need, if there is a lot of atrophy, we need to use local estrogen to increase local estrogen in the vaginal to make this vaginal ready to intercourse, because feeling pain during intercourse because of dryness is very difficult issue, which we must deal with it. As I told, there is a lot of things like using plasma, which is rich by collagen, elastin, and growth hormone, which making vaginal functional again.
Thank you so much, Dr. Basema, for sharing your knowledge and valuable insights on menopause with us today. Your expertise has made this important topic very easy for all of us to understand.
Thank you. Thank you for this chance, my dear.
Thank you so much for your time and for your knowledge. And to our audience, we hope that you found this episode interesting. And if you're a healthcare professional, don't forget to subscribe and register on our MedSynapse platform for exclusive content and updates. Your engagement and support are very valuable as we continue to explore critical healthcare topics. Thank you for tuning into MedSynapse Specialist Podcast series, and stay tuned for more informative discussions in the future. Goodbye.